Assalamu alaikum. My name is Ali Mashik and my group members are Muhammad Ahmad, Zain Ahmad and Muhammad Bilal. Today I am going to give my presentation on the topic of Pregabalin tablet. So first of all, what is Pregabalin tablet? Pregabalin belongs to the class of anticonvulsant drugs, means they are used against convulsions. They are also used for the neuropathic pain and as adjunct therapy for the partial seizures. Pregabalin is an anxiolytic drug, means they are used for anxiety, and pregabalin is more potent than gabapentin. Pregabalin is 6 times more potent as compared to the gabapentin. Pregabalin is marketed by the Pfizer under the brand name Lyrica. It is analgesic, means painkiller, anticonvulsant, anxiolytic and sleep modulator. Pregabalin is also used to treat fibromyalgia, chronic pain, nerve pain associated with diabetic neuropathy, pains from shingles which are also known as herpes zoster, nerve pain from spinal cord injury. In anxiety, it works by stop your brain from releasing the chemicals that make you feel anxious. Next is the chemistry and history of pregabalin. Pregabalin is structurally similar to the GABA aminobutyric acid, which is an inhibitory neurotransmitter, but it does not bind to the GABA receptor. Chemical structure of pregabalin is C8H17NO2. Pregabalin has a molecular weight of 159.23 grams per mole. Pregabalin was synthesized by the Richard Bruce Silverman at the Northwestern University in the US. This drug was approved by the Food and Drug Administration in 2004 for use in the epilepsy, diabetic neuropathy pain and post-herpetic neuralgia, and this drug come in US market in 2005. Next is the pharmacology of pregabalin. First we will talk about the pharmacokinetics. Pharmacokinetics is what body does to the drug. It includes following points, which is absorption, distribution, metabolism and elimination. First of all, we will talk about absorption. Pregabalin is rapidly absorbed when administered in the fasted state. Pregabalin oral bioavailability is estimated to be more than 90%. The rate of pregabalin absorption is decreased when given with food. However, administration of pregabalin with food has no clinical significant effect on the pregabalin absorption. Next is the distribution. Pregabalin has been shown to cross the blood-brain barrier. It crosses the blood-brain barrier, so it means that it is lipophilic drug. Pregabalin also has shown to cross the placenta in rats and is present in the milk of lactating rats. In humans, the apparent volume of distribution of pregabalin is approximately 0.56 liter per kg. Protein binding. Pregabalin is not bound to the plasma proteins. Next is the biotransformation or metabolism. Pregabalin undergoes negligible biotransformation in humans. Less than 2% of pregabalin is metabolized. And the last one is the elimination. Pregabalin is eliminated from the systemic circulation primarily by renal excretion as unchanged drug. Pregabalin mean elimination half-life is 6.3 hours. Pregabalin plasma clearance and renal clearance are directly proportional to the creatinine clearance. Next is the pharmacodynamics of pregabalin. Pharmacodynamics is what drug does to the body. As we already said that structure of pregabalin is similar to the GABA aminobutyric acid, but it does not bind to the GABA receptor. Instead, it binds to the alpha-2 delta subunit of presynaptic voltage-gated calcium channels in the central nervous system and inhibits the. Here is the calcium channels on which pregabalin acts and binds and inhibit the calcium conductors. By binding presynaptically to the alpha-2 delta subunit of voltage-gated calcium channel, pregabalin modulates the release of several excitatory neurotransmitters, which includes glutamate, substance P, norepinephrine and calcitonin. Next one is the nerve injury. When nerve injury occurs, it increases depolarization, which results in the activation of voltage-gated calcium channel, which increases calcium influx, and calcium influx causes pain in two ways. First one is that it increases substance P and COX-2, which causes pain sensation, and the second one is that it increases glutamate release and it causes activation of NMDA neuronal firing, which causes pain. What pregabalin work? Pregabalin inhibit the pain in three ways. First one is that when we give pregabalin, then it inhibit the potassium activation, due to which there is no increased depolarization and all these steps does not occur. Second one is that pregabalin directly inhibit the activation of voltage gated channel. When voltage gated calcium channel is inhibited, then there is no calcium influx and no pain sensation. Third one is that pregabalin inhibit the glucose transport. When glucose transport are inhibited, then there is no glutamate that are transported. When glutamate is not transported, then there is no pain sensation. So pregabalin inhibit the pain in following three ways. Next is the clinical uses of pregabalin. Pregabalin is used for the treatment of neuropathic pain in adults, adjunctive therapy in adults with partial seizures, fibromyalgia pain, and generalized anxiety disorders. Dose of pregabalin in diabetic peripheral neuropathic pain. The dose of pregabalin is 50 mg per day, mean 20 mg twice in a day. In post-herpetic neuralgia, the dose of pregabalin is 150 to 300 mg per day, means 75 mg 2 times in a day. In fibromyalgia, initial dose is 75 mg per day, and in partial onset seizures, the dose is same 150 mg per day, means 75 2 times in a day. Next is the side effects of pregabalin. Following are the side effects of pregabalin, which includes dizziness, drowsiness, swelling in your hands and feet, trouble concentrating, weight gain, dry mouth, blurred vision, headache, feeling sick, difficulties with getting an erection, and memory problems. Then the point comes is there that how to cope with these side effects. If these side effects occur, then how we can cope them. So first one is the dizziness and drowsiness. Do not drive, cycle, or use machinery until you feel better. As your body gets used to pregabalin, these side effects should be wear off. But if these side effects would not wear off within a week or two, your doctor may reduce your dose or increase it more slowly. If it does not work, you may need to switch to a different medicine. Second is the swelling in your hands and feet. If your feet are swollen, try sitting with your feet up to a chair or bed and try not to stand for a longer time. Exercise might help if your arms are swollen. If that does not help or it becomes painful, contact your doctor. Third one is the trouble concentrating. Pregabalin causes trouble in concentrating, in focusing, especially in the elder patients. Next is the weight gain. Pregabalin can make you more hungrier, so it can be quite a challenge to stop yourself putting on weight. Try to eat well without increasing your portion size. Do not snack on foods that contain a lot of calories, such as cakes, biscuits, and sweet. If you are hungry between meals, eat fruit and vegetables and eat low-calorie foods. Increases your level of exercise will also help to keep your body weight stable. Next is the dry mouth. Dry mouth can lead to the dehydration. Signs of dehydration includes peeing less than usual or having dark, strong smelling pee. Do not take any other medicines to treat diarrhea without speaking to a pharmacist or doctor. Drinking lots of fluid such as water can help you to avoid dehydration. Next is the blurred vision. Do not drive, cycle, or use tools or any machinery while this is happening. If it lasts for more than a day or 2 days, speak to your doctor as they may need to change your treatment. Next is the headache. Make sure you take rest and drink plenty of fluids. Try not to drink too much alcohol. Ask your pharmacist to recommend you a painkiller. Headaches usually gone in a week. Talk to your doctor if they last longer for a week or are severe. Feeling sick. Take pregabalin with or after a meal or snack to ease your symptoms. It may also help if you avoid rich or spicy foods. Difficulty with getting an erection. Speak to your doctor, as they may be able to change your medicine or offer another treatment that might help to overcome this problem. Last one is the memory problems. If you are having problems with your memory, speak to your doctor. They may want to try to suggest you a different medicine. Next is the pregnancy and lactation. Small amount of pregabalin have been detected in the milk of lactating women. Based on animal studies, there is a potential risk of tumorigenicity with pregabalin exposure via breast milk to the breastfed infant. If consult to your doctor, if your doctor say that your baby is healthy and you are getting benefit from pregabalin, then you can use pregabalin. And there is one suggestion and recommendation that when you are using pregabalin in pregnancy, then use folic acid dose 5 mg per day for 12 weeks or 3 months. Next is the fertility in men. Pregabalin can temporarily decrease sperm count in men and may affect the fertility in men, your ability to have children. In this way, it causes birth defects in offspring of males treated with this medicine. Interactions. There are almost 280 drugs that are known to interact with the Lyrica यानी कि pregabalin. Almost 6 disease interactions and 1 interaction is due to alcohol or food. Out of these 280 drugs, 27 drugs are major, 1 is the minor, and 252 are moderate. First interaction is pregabalin and clobazam. Clobazam brand name is Frisium, marketed by the Sanofi Aventis. When pregabalin is given with the clobazam, it increases potential for CNS effects. When pregabalin is given with the ACE inhibitors, it causes high risk of developing angioedema of face, mouth and neck. However, this list is not complete. Other drugs may also compete with the pregabalin, interact with the pregabalin, including prescription and over-the-counter medicines, includes vitamins and herbal products. Toxicity and treatments. The most common symptom of pregabalin toxicity dose ranges from 800 mg per day and single dose up to 11,500 mg. The symptoms include somnolence, confusion, restlessness, agitation, depression. Since there is no specific antidote for the pregabalin overdose, but if the drug is unabsorbed, then gastric lavage and emesis are the processes that can be carried out to rid from this drug, and if there is a severe condition, then hemodialysis can be carried out. But in most cases, it is seen that patient can come to the normal condition by supportive care only. Last one is the conclusion, which includes following steps: effectiveness, safety profile, mechanism of action and FDA approval. First one is the effectiveness. Pregabalin has been shown to be effective in managing various types of neuropathic pain, including diabetic neuropathy, post-herpetic neuralgia, and neuropathic pain associated with spinal cord injury. Clinical studies have demonstrated its efficacy in reducing pain intensity and improving quality of life for patients with neuropathic pain, as well as improving sleep quality. Next is the safe profile. Pregabalin has been extensively studied and has generally shown a favorable safety profile. It is well tolerated by most patients, and common side effects include dizziness, drowsiness, and all of that we discussed in the previous slide. Next is the mechanism of action. Works by binding to the certain calcium channels in the central nervous system, which reduces the release of certain neurotransmitters such as substance P and glutamate. This mechanism is believed to help calm overactive nerves and alleviate neuropathic pain. Last point is the FDA approval. Pregabalin has received approval from regulatory authorities such as US Food and Drug Administration for the treatment of neuropathic pain associated with several conditions, including diabetic neuropathy, post-herpetic neuralgia, and fibromyalgia. Its approval status and availability contribute to its widespread use. And the last one is the brand names of pregabalin tablet. It includes Lyrica, Hyline, Spingap, Zilica, and Gabica, which are marketed by the Farmivo, Guess Pharma, Searle, Hainon and Sami. I hope you will understand this video, and after watching this video you have an idea about the Pregabalin tablet, that what is this tablet and for what purposes it is used, and you should have some addition in your knowledge. That's all from my side. Thank you so much.